those that are asking, when will I come live? So let me quickly do a quick live today. Let me dress myself. I just finished shooting, and I usually do a quick live after shooting. I could not shoot in the evening yesterday. Messy. I need to rest my back. It's really busy day. I don't usually expect much people during this time of the day, but it's just like a test try to see if I'm going to get anybody online to ask their questions again. Hello everyone. If you are watching us Miss Mary live, just drop a comment on the comment section. Okay. Hello everyone. This is Miss Mary live here. I just finished shooting and I decided to pop up just a quick live video to see if there is any follower online. Though most times, like, my followers are usually here in the evening, like around 5, 6, 7. So I decided to do a 30 minutes quick live to see if there is any question for me to take, and if there's anything that you want to learn from me. Any questions general for me to take? Hello, if you're watching, just let me know where you're watching from. Drop it in the comment section and also drop your questions. We have Yash Vash. Hello from Indian. Hello Yash, how are you doing? And how is Indian today? Is it a bright sunny day or it's a cold day? Just let me know. It's nice having you on my live, Yash. So we have Aslam Chisom. We have Aslam Chisom say, what is the best drugs to cure Helicobacter pylori? Helicobacter pylori, it's a bacteria, so the doctors are going to prescribe for you some antibiotics to help with it. And if it's an ulcer, generally you are treated, they are going to combine different types of treatments to help you out with the ulcer. Okay? So that's Aslam. Just let me know if your question is answered. Then I have Heta Shilongo. Heta Shilongo, hello, how are you? How are you doing? Trust you're doing great. We have PROS. PROS said hi. Hello, PROS. Then we have Sheradik Navid. Hope I'm pronouncing it properly. Hi, hello, how are you doing? Then we have Heta Shilongo. Hello from UK. Hello. Then we have Anastasia Timothy. Hello, Ma, from Nigeria. It's nice having you here on my live. It's a 30 minutes live. So if you have question, it's important for you to type the question now. It's important for you to pop the question now that I'm live. I just have 30 minutes to spend on this live video. That's the highest I can go. Then we have PRS from Indian. Nice having you all here. Then we have Samuel. Antinos, you are doing well. Keep it up. Happy weekend, Ma. Thank you very much for your beautiful comments, and I hope our videos have been educational to you. Then we have a Malanga. Hello, Malanga. Where are you from? What country has that name? I would like to know. Hello, Malanga. How are you doing? And trust you are doing great. It's a beautiful afternoon here in the UK, and I decided to come live to say hello in 30 minutes. I only have 30 minutes, then I'll be going offline. So we have a Modesta, Ofoke Modesta. Hello, hello, Modesta. How are you doing? And trust you're doing great. Oh, Zimbabwe. I have a Zimbabwe friend. Her name is Rombi. Rombi, yeah. I have a Zimbabwe friend. We're very good. I think we've made one video together like a short video. I and Rumbi, she's from Zimbabwe. We made a video together and we uploaded it on my YouTube channel. You can check for your Zimbabwe sister on my YouTube channel. I think Zimbabwe ladies are very pretty. Yes, the Zimbabwe ladies have come in contact. They are really very pretty and they are nice. Rumbi, if you are watching this live or anytime you're watching this night live, just know I love you and thank you for coming across my path. Yeah, Zimbabweans, I've come across a lot of Zimbabweans. I've come across a lot of Indians. Like most of my colleagues at work are from Indians, and I must say they are lovely. I've not really encountered anybody from Zimbabwe or anybody from Indians that have showed me shege. They have been really nice. My work colleague, like they showed they were nice, especially when I was pregnant. I experienced this love and care from them. Yeah, and also from my Zimbabwe friends. So it's nice having you all. Just ask your questions because I have approximately less than 30 minutes to be on this live video. I have approximately less than 30 minutes to be on this live video to take your questions. Hello, just let me know where you are watching from. Let's know where our fans are actually watching us from. Then if there's any question, pop in the comment section. If it's a question that requires me to make a video, definitely I'm going to make a video just for you. I'm going to make it a video just for you to watch. It's amazing how you do the things you do for me. Handogo, live from Namibia. Hello, Nadogo. How are you doing? Trust you are doing great from Namibia. I don't really have a friend from Namibia. I've not really worked with a Namibia colleague. Oh, I wish I had one. Let me know how the Namibia people looks like. Let me know if they're nice. And Namibia is nice. Let me know. Hey, Dogo, let me know if Namibia people are nice, lovely, friendly. So I go and look for a Namibia friend. You can be my Namibia friend. It's not a bad thing. So we have Keep said, hello, ma'am, from Manipur inside. I want to say something terrible. Please, we don't accept something terrible here. So if you want to say something terrible, it's not advisable you say something terrible here. But you can ask your questions in regards to your health. But when it comes to say something terrible, since you already mentioned it's terrible, I don't advise you say it. Please don't say something terrible on our YouTube channel. We talk about health. We talk about sexual health and reproductive health, but we don't say things that are terrible. So Hunter say, can you please help me the meaning of bilaterally? The ovaries appear morphologically polycystic, no obvious adnexamasis or cyst seen. Appear morphologically polycystic. It could be like that. Reading could simply mean that, is it, did the doctor talk about PCOS to you? Did the doctor talk about PCOS? It could be that bilaterally appears morphologically polycystic. Sorry, let me just check. Just give me some time, please. Okay, yeah. It says it's a key feature for polycystic ovary syndrome. Yeah, it simply means that your ovaries can be having a little, like a cyst. So when you say morphologically polycystic, it's a key feature from the scan that you might be having PCOS or you have PCOS. So now is to like know how to manage it. If you are trying to get pregnant, know how to manage it and get pregnant, or know how to manage it to avoid pregnancy. Okay, so bilateral morphologically polycystic is a sign that there could be a PCOS or there is a PCOS. Srivansapi, I can't understand your language. I can't understand your language. He blocked me. Okay, Kena said, last night I had a deep pain in my chest, right side, but it actually occurred after training, so that is really the problem. Anything in regards to your chest, I am not like a cardiothoracic doctor. If you know you have like a deep pain in your chest, I would advise you to see a doctor. The doctor might advise you to get a chest x-ray done just to find out what is wrong there. Okay, sometimes that strenuous exercise, I don't know which training you are doing, but that training might be what is that's something that's aggravating that pain, something that's increasing that pain you are experiencing. So if you are experiencing such pains in your chest, I would advise you to see a doctor. Probably he or she might recommend a chest x-ray. Okay, I think I have another question. Okay, this is what they said. Let me go back to your test again. I'll see if I can explain it. But see, I'm going to explain it to the best of my knowledge. But if you want to get a real explanation, you should speak to your doctor. I'm going to be explaining it to what my brain tells me it is. Okay, but it might be wrong, but this is what I think it is. It's a can you help me with the meaning of bilaterally? Bilaterally, the ovaries appear morphologically polycystic, no obvious adrenal masses or cysts seen. The first thing, it shows that your two ovaries, from the first point of view, it shows that your two ovaries are polycystic. There's a cyst there. That no obvious adrenal masses or cystic seed, it could be talking about your adrenal gland entirely, different from your ovaries. So that is what I feel I can read from what you dropped there. Hater, that's what I feel I can read from what you dropped there. That no adrenal mass is talking about the adrenal gland and all those things. No cyst is seen there. But your ovaries, it shows that there is a polycystic, there is a cyst in it. Farouk said, hey, I get pain in my scrotum. If the pain is severe, that mild pain sometimes might be normal. But if it's severe, it's frequent, I'll advise you to see the doctor. Especially if you are worried about it, it's not what it used to be before. I'll advise you to see the doctor, Farouk. See a doctor for proper scrotal examination. See your doctor for proper scrotal examination, Farouk. God forbid, that's it. You're welcome, Farouk. Farouk said, is there any drugs to last in bed for 1 hour? Okay, that's a big question, in the sense that why do you want to last in bed for 1 hour? What do you hope to achieve with it? That is it. Then if you know you're not lasting like for the normal time you are expected to, it could be possible you have erectile dysfunction, and it could be possible there's problem with your erection. And sometimes it might not be problem with your erection, it might just be environmental factors like having relationship issues, you're being stressed out, you're having anxiety, can actually affect your erection. That's also something you should consider thinking. Then you can take some natural food like some bananas, some dates, some combination. It tells you those fruits, they are generally healthy, but some people notice that whenever they take those fruits, it helps them with erectile dysfunction. So you can try that. That can help you boost your erection. So the other person said, Nurse, I have ear problem. The doctor gave me medicine, but no use small hair feature entering my ENT. Also did not see nothing. Can you tell me something why? Um, I don't understand your question, please. I don't understand your question. Like, I don't understand your question. I know you said you have ear problem. I don't know what's the medicine. I don't know what you're trying to say. But if you have ear problem, generally I would advise you to see an ENT doctor, ear, nose, and throat doctor. They are the one in charge of ENT. I don't have a specialty in ENT, and I don't have a broad knowledge in ENT. The only thing I know about my ENT was the basis we were taught in nursing. So I don't have a detailed um, lecture on that, and I can't advise you strictly on that. So I'll advise you to see an ENT doctor to help. If they've given you medication and it's not working, it's better for you to go back to the hospital and lay complaint to them and let them find a better solution to it. So I've said what you should do. So that's the best I can give. That's the best advice I can give in regards to that. That is for you to see an ENT doctor, ENT specialist, so they are able to help you out with that. Because I have no broad knowledge on ENT, ear, nose, and throat. I'm not a doctor generally. I'm not a doctor, I am not a specialist. So most of the times your doctors are in the best position to know what to give you and what is going to work for you. Mine is just to give health education based on experience as a mother, as a wife, and also as a trained midwife back home. Then the other is, hi, Nurse Mary. Please, how can a nurse travel immediately after nursing school? How can a nurse travel immediately after nursing school? It all depends on the country you're planning to travel to. Yes, it all depends on the country you are traveling to. First of all, you have to get your permanent license. So if you are going for nursing school, I think it's much easier to get your permanent license as a nurse from nursing school. But if you go through the university, you will have to finish your internship before you get your permanent license. So after your permanent license, you can start the processing. And the route differences, if no, the route differs depending on the country you are going to. The routes for UK, the routes for Canada, the routes for USA is different. In terms of the routes for UK, we all know that it's important. What is it's important, especially you have to write your IELTS, your IELTS exams, which test your English capability. The English wants us to write the exam. So when you write that, you have to write what's called the CBT, which is their computer-based test in regards to nursing too. So when you pass those two, back then you look for a job and you get some sponsorship right from when you are home. But these days, you have to, some people have to travel down to the UK to take their OSCE, pass their OSCE before they get opportunities, before they get their jobs. So that is what I have to say in regards to UK. In terms of Canada and USA, I have no good knowledge in regards to that, but I know there is an exam they write which is NCLEX you write. I've not written mine, but I think that's the exam they write for UK, sorry, USA and Canada. But for UK, it's just CBT that you have to write. But your IELTS is very important for whichever country you're going to and whichever process you're going to be using for your visa. Farouk, I've answered your question. I said you should go for a scrotal examination. You should see a doctor for scrotal examination since the pain is there. If the pain is causing discomfort, it's better for you to see a doctor for scrotal examination to find out what is wrong. Generally, it's okay to have this mild pain. Like, I'm not meaning, I'm not talking when you touch it or do this, is normal for you to have this mild pain. But if you notice the pain is causing discomfort, it's severe, please and please see the doctor as soon as possible. Don't joke with your health. So Farouk, I've answered your question again, and I hope you've heard, because I've answered it before and you said yes. You answered, you said thanks a lot, but now you are saying answer me please. So I've answered it again for you. I'm just quickly going to check my daughter in her room. Okay. Okay, Kai said, thank you, nurse. I am a student nurse, and your videos have helped me with my studies. Thanks. How is our baby? Everybody's doing fine. I'm glad my videos have been able to help you with your studies. Baby is fine. Everybody is fine. We thank God for it. And if you are a student nurse, you are not on our Telegram channel, I think you are missing a lot, because most of our classes, most of our lectures are on Telegram classes, on our Telegram page, where you have access to the voice notes. This voice notes actually prepares you for the Nursing and Midwifery Council exams. Yeah, we've had a lot of stories about it, but just that these days on YouTube channel, we went broader. So we are no longer focused on just the nursing students. We are focused on the general public, general health, sex and reproductive health. But if you want more intense lectures in terms of nursing and midwifery council, I will advise you subscribe to our Telegram channel, because that's going to help you. You're going to get different voice notes explaining different systems in nursing and midwifery. I'm having some inching throats. I think I have flu. My daughter got to school and brought it back. So you can send me a message on WhatsApp on let me just see if I can. Okay, 081. If you are typing, you can type the number on the screen. Let me send the number to you. You can send a message on WhatsApp, then I'm going to send you the account details. It's paid for, so no need to start breaking it. It's paid for, and it's 7,500 naira. So if you want to have access to this voice notes on Telegram, it's paid for. It's 7,500 naira, and the to get in contact with me, you have to have my number, and that is 081 081 23 71 9105. So that is the WhatsApp number. You can use it to contact me on WhatsApp to get account details to make payments. It's not actually free, it's paid for. So I think my sister has been trying to reach me. So I'm a live video now. So I need to tell her that. So I needed to show her. She has been trying to reach me, my kid sister. So I told her I was going to call her back later. So I had to like show her that, okay, I'm actually busy. I'll get back to you. Okay, Chris said, I got a number. I'll get back to you. Thanks. You're welcome. Just going to drop a message with her. So like I earlier said, I have 30 minutes to spend on this live. So I have just 6 minutes left. Farouk, I have answered your question several times. And whenever I answer your question, you said, okay, you said thanks. I've answered your question twice now, Farouk. I've answered your question twice, Farouk. I don't know if you are coming and going. But Farouk, I've answered your question. And in summary, what I advise you to do is to go for the scrotal examination. I can't find the other question. That is the only question I found. Maybe YouTube is removing it. That's why I can't see the question. I guess YouTube is taking it out. So that's why the questions are not popping up. There are some questions that YouTube scrutinize and they take it out by themselves automatically. So that could be YouTube doing its thing and not me. My child has testicles in his scrotum. Why betting? Both of them are there. You said he has one, but why betting? Both of them are there. Okay, let me tell you something. When a child is born, they may have two of the testicles in the scrotum, but one comes down first, and sometimes the other one takes time to come down. Why sometimes both of them, you can just see both of them down. You know, like the two of them does not come down automatically sometimes. So if you see one, just be patient, the other might come down. And make sure the nurse assess it. You don't do the assessment alone. You can take your child to the nurse, let them check and see how it is. Sometimes the other scrotum comes down automatically by themselves. So today is the only day I have to spend on this live. Farouk, did you get the answer to the question? Okay, he said treatment for my wife smelling vagina. First of all, what kind of smell is she having? Is it foul smell? Is it fishy smell? So that's going to know what type of treatment you are going to use. Okay, what type of smell? Generally, if it's fishy, that could be bacterial vaginosis. She might be needing antibiotics. I'm not telling you to go and buy antibiotics for her. What I'm advising you to do now is to take her to the your healthcare provider to actually prescribe these medications for her. She can take it, and that can help with the infection. So fishy smell is associated with bacterial vaginosis. Yeah. Did you get that? Okay. Yeah. So as like I said, fishy smell can be associated with bacterial vaginosis, and she might be needing some antibiotics to actually treat it. So when you take her to the doctors are going to prescribe a particular antibiotics for her. Then they might do a vaginal swab test just to confirm. So I have just 2 minutes, less than 2 minutes to go. So with these 2 minutes, I can take one or two questions. I have just less than 2 minutes to go. So Farouk said, "You are such a great nurse. God bless you. God bless you too. Thank you for the beautiful comments." So I have less than 2 minutes to go. And like I said, I only have 30 minutes because I planned it and my child will soon need my attention. So I have 1 minute more and I will be ending this live. If you have any question, quickly pop the live, quickly pop it on the live video. And if you've not liked the video, just double tap on the screen to like the live video. Double tap on the screen and you've automatically liked our video. So if you're watching and you've not double tap on the screen, just double tap on the screen and it automatically likes the video. So I'll be going off now. In 10 seconds, I'll be going off live and I'm going to see everybody on my next live. Like I said, my life are not predictable. All right. Thank you all for coming in our live. Thank you all for dropping your questions, and bye, and see you in our next live. Oh, Claudine came late. Bye. See you in our next live, Claudine. Thank you very much for joining our live video. Just 30 minutes live with Nurse Mercy Mary. Bye, everyone.